I'm Dr. Beth Bazine, and I practice optometry and vision therapy in Kansas City, Missouri. This is really special to be able to share this story with you. A dear friend of optometry and a person who's dedicated her life and her whole family to furthering the education of children, particularly underprivileged children in Kansas City, told me about this boy and his adopted mom, and that he'd had surgeries on his eyes as a little boy because his eyes crossed. And now his eye went out, and she said they want to do everything they can to help him. And of course I was a little intimidated by this, in that she said his eye went out all the time. But the interesting thing about it, when they walked in the door, here's not just the mom and the patient, but the tutor came along. There's a support behind this child here, this young man, of people who are going to help him throughout his life be successful. So of course, my first question to them was, what, is this blindside or something? So now I think Mom, Sister Bertie, is going to talk next and tell you a little bit about his story.
Ronnie came to us as a 4-month-old baby. We were his like 8th or 10th placement because he was so ill. He had so many issues, and one of the issues he had were terribly crossed eyes. His eyes touched almost the edge of his nose. They were so far in. And we had Ronnie for about a week. We called and made an appointment at Mercy. And when we brought him in, the doctor said, "Why did you wait so long?" And we said, "Well, we've only had him a week and we had to get an appointment." He said, "It's possibly too late to save his depth vision." So we encouraged them to do the surgery as quickly as they could. They did it. I think he's had 3 or 4 follow-up surgeries with his eyes. But no one ever mentioned that that didn't solve the problem. And I think that's what we feel bad about, that if we knew that this problem wasn't solved by the surgeries, we would have done something about it. When he was about 7, the same lady Dr. Brazine was talking about told us about a vision therapist that was somewhere else in the city. And we took Ronnie there. And they said if they worked with him, now this was about when Ronnie was about 7 years old, that he would possibly have double vision for the rest of his life. So we were afraid to even try that because we thought that wouldn't be a good thing for him, and so we didn't do that. We took him to the really good eye doctors who prescribed glasses for him, and we thought we were doing everything we could to help him, and we weren't, because we hadn't solved the problem, and Ronnie didn't know he was not seeing like he should see until we brought him here. And when he first started, I thought, I hope this stuff is for real. And Dr. Brazine was working with him one day, and he's a very good athlete, and she was having him catch balls with his old glasses on without his contacts. And he had to move his whole body to catch the ball. And then he put his contacts in, and she put the new glasses on, and he could catch it by just moving his arm. And that convinced me that this made a huge difference. He used to be on focal, and because of behavior issues, he doesn't take medication anymore. He's doing much better in school. His whole demeanor is better. And I just think, I feel really bad that it took us 16 years to figure out that there was a problem that we could have had fixed. And I really feel that when surgeons do this and fix a kid's crossed eyes, somebody needs to tell you there's this option, there's this option, there's this option, so you can pick. If you don't know I thought that when they did the surgery, they fixed the problem. And I think a lot of other people do, and I'm so grateful we found this. When he was 16, it's made a huge difference in his life. I wish we had found it when he was 3.
Now I think Mary's going to talk for a minute. She's the tutor who's worked with him, and she might give us some perspectives on how this has helped him overall in his life.
I first met Ronnie when he was 11, and Sister Berta brought him to enroll. I'm a grade school principal to start with, and she brought him to enroll in our junior high. And his right eye pulled out significantly, and it was very obvious. And we worked with him, and one-on-one, my staff The first thing you notice about Ronnie to start with is she's got an incredible, charming personality, very outgoing, very dynamic, fun to be around. And the kids, he drew friends to himself very quickly. But school was very hard for him, and when it got very difficult, especially when it was paper, pencil, writing, and long-term reading, was very, very hard for him. And he couldn't stay on task when he did that. In his freshman year in high school, Sister Berta asked me to start tutoring him, and I did. And I developed a deeper understanding of who he was as a student. And he's an excellent thinker, had a lot of good, deep questions about what he heard or what he knew, had a great deal of knowledge about certain things, but to sit down and read a long amount of text and to remember what he'd read in text and to stay focused on it was very, very difficult, as well as writing an essay. And math has always been very challenging to him. And he would come to me and had not copied any notes off of the board or off of the overhead. And that was very hard for him. And it wasn't that he didn't try, and it wasn't that he didn't have a work ethic, because he's probably got the strongest work ethic of a child I've ever worked with in all of my years in education. And so one of the things I kept saying to Sister Berta is, he is so very, very bright. And there is so much there. It just doesn't show up in schoolwork. And so when she suggested we try vision therapy, I was really willing to give it a shot because I knew there was something there and I just couldn't get it to look like what I wanted it to look like and what I knew he was capable of. After we started coming, he requested to not take the focal in. And the agreement we made was you have to stay focused on your work and be calm in class and good to your teachers. And they reported actually more alertness without the medication, and he was much easier for them to interact with. He was able to copy off the board more. He came to me with more notes. He came to me by mid-February with much more, at least half of the written work done, much more successful, able to read a longer text. Up until then, we had done all of our books audio, and this spring he was able to read on his own without an audio support and understand what he'd read, which is huge. And that started after he'd only been here about 8 weeks, which was wonderful to see. And it has continued beyond that. His coaches have reported how much more interactive he is socially, how much more fun he is to be around, and how much more successful he is on the field. Even though he's always been successful, he's even more successful and more aware of what's going on around him. So they're excited to see it.
So what did you think the first time you came into vision therapy and we put the 3D glasses on you and you saw that thing floating out in the room at you? Had you ever seen that kind of thing before?
I never saw that kind of thing before. And I was really surprised what I was seeing. And after a couple of times I came, I started to see out of both eyes, which never happened before. So yeah, really amazed me. And the more I came, the more I looked out of both eyes. And now I look at them both eyes more often. And school is easier, sports, everything you can really think of.
I know I was talking to Mary the other day and she was saying that during the process of you doing vision therapy that you thought you saw flashes almost of something someplace else. And I wondered if that wasn't maybe seeing things in double, which when you let one eye go, you don't see things in double. You're only seeing out one eye. And I wondered if during this process of going from seeing with one eye to seeing with two eyes, you know how you can see the bead come at you now and two strings, that in the process of that transition, for a while you might have been confused if you saw something moves, appear to be in a different place. Were there periods of time that was confusing for you as your vision changed?
Yeah, for a short time period there was a little confusion because I didn't know if I was seeing the right thing, and also, yeah, it was just confusing.
Do you think that copying from the board thing, how difficult it was before, had to do with maybe switching your eyes, which eye you used?
Yeah.
Or not knowing where it was when you look back, it's someplace else?
Yeah, it was very challenging because I guess I had to change which eye I was switching, so most of the time I used my right, But then when I looked down, I used my left. And the more I did it, the more hard it got. And it just got frustrating.
So when you got your contacts, that was real different,
Oh,
wasn't
yeah.
it? So what was it like? I also heard stories about when you got off the soccer field. You said, "Oh my gosh, I can see so much better with those contacts."
Yeah, it was like having my glasses on, but they weren't on. I could see everything.
Could you tell where the soccer ball was and when it was coming at you
Oh, yeah.
sooner?
Mhm.
So I guess for those of us who see in 3D all the time, we don't know what it was like for you when you saw things just with one eye and that the world was flat, and what it was like as it started to change. Was it like high definition?
Something like that. Very similar.
Are there periods of time now still when, because you haven't graduated from vision therapy yet, we still have some work to do, but are there periods of time when sometimes things are more 3D than others and you know your eyes are really working together then?
Yeah, like when we do the little bead.
Uh-huh, the bead on the string.
Yeah.
What about in sports?
Oh, I can catch the ball better.
You
A
can't.
lot better.
So do you think that's going to help your running?
Oh, yeah. Tremendously.
Well, we can't wait till the football season starts and we get to watch. That's for sure. And you think you're going to be able to get your written schoolwork done faster now?
Yes, because I'm using both eyes.
Yeah.
And it won't be so hard to copy off the board.
Maybe you'll know where your paper is and your
Yeah.
pencil is faster and be
Yeah.
able to get there faster.
Yep.
Well, I know it's really been fun. There's not a lot of stories that are as unique as this story is, but I know, I feel certain that you're destined for great things. We don't know what they're going to be yet, but we all know that you're one of the hardest working kids we've ever seen. And I know that every time you come to vision therapy, sometimes you complain, okay?
Yeah.
But that's because everything we're asking you to do is hard. It is very hard. And you might complain a little bit, but you always do it. You always want to come, and you never quit. So that's I think, pure testimony to the fact that we know you're going to be successful. And it's a whole lot of fun to work with you.
Oh, thank you.
Thanks for coming. And thank you guys too
Thank
for
you.
all you've done. I guess we all owe Dorothy a thanks too.
Absolutely.
In all of this.
Absolutely.
Yes.
And it's going to be exciting to
It is
see
exciting.
as things get better and better and better in your life.